doctors. Thank you for having me here and making me part of this beautiful yet need of the hour event. And thanks to my friend Urjitha for inviting me today. I always tell people that the more we talk about cancer, the less we can fear it. I think fear seems to kill more people than the cancer itself. So I think it is important that we have these kind of awareness program, take it across to people. And I think, like everyone says, we need to take care of the women in our lives. I think the men should take it upon themselves to take care of the women in their lives. The fathers, the sons, I think you guys need to, because the women are too busy taking care of the men all the time. So I think it's important that you, for a minute, even children, and ask them to encourage their mothers to go and do the screening. I think that would be a big success, in my opinion. Actually, when you guys were telling me about this mammogram, at 20, if you believe it or not, I went to a doctor. I had fibroid adenoma in both my breasts, and I was 20 years old. And somehow, I don't know where I got this, like guts and courage. I went to the doctor myself because both my parents are working. From a very young age, we were all encouraged to go take care of ourselves. So I went to the doctor said you have to do a mammogram. I went to a mammogram institute all by myself. And they were all looking at me like, you came alone, why isn't anyone, like no adult with you? I said, I know what's the big deal. I didn't know until at that point that how important that mammogram was. And then I took that report and I went to my parents and said, you know what, I did all these tests, you have to go to the doctor now and figure out what to do. So it needn't be fear, it can be something like the doctor said, if 99% can be cured at early detection, I think this is something that everyone has to, talk about this at homes. Like, it should become a table conversation about, okay, you know what, cancer is prevalent now, but cancer can also be treated early. So you need to do it sooner than later. So even my friends, when, like you say, when I'm having this talk with my friends and they're like, you know what, I have this illness or something going on with my body, but I don't have time, I'm so busy at work, I'm so busy taking care of my children. I'm like, if you can't prioritize yourself, if you can't put yourself over everyone else, then who else is? Everything what you're achieving in your life is, at the end of the day, only if you're going to be better health-wise, you're going to also do better. There is a reason why in an airplane, they tell you if there's going to be turbulence, first keep the oxygen mask for yourself and then keep it for your children. That's the way we've got to also look at ourselves. It's okay to be selfish when it comes to our own health because we can take better care of others. I think it's a really good analogy to apply in our own lives today. We might appear to be, because physical health, like doctor said, overweight is also one of the reasons, and physical health goes hand in hand with mental health, because physical health, when you're hitting the gym, your hormones are going to be in balance, and your hormones are going to be in balance, your mental health is also going to be in balance. So these are all small things, like, we don't take it seriously, like, oh, I don't have time for gym. We are not actually telling, even the gym aspect is not to look good, but to also feel good, because mental health is another thing that everyone seems to suffer today. So I'm really happy to be part of this event, and I wish you all the very best. I think it's a wonderful idea to bring everything under one roof, to make a patient feel comfortable, to come forward and say, I have this, and cancer should not be like a taboo. Everyone should talk about it, because today when somebody has cancer, the first thing they try to do is hide the fact, because for some reason they feel embarrassed or they think, I don't want people to know, but it's okay for people to know so that there's more support and you can address it. So thanks a lot. And when I said Urjitha was my friend, I think all of you would have wondered, like, there's a lot of age difference, how come she can be my friend? She's my niece's friend, and my niece is actually my friend because I've somehow trained her not to call me Kiruthiga. So I like drop the chitti, just call me Kiru. So she keeps calling me Kiru, only except when her father is there, she adds chitti to it. So it's actually a very, and now that she's expecting, she's like, okay, now I want to see how you're going to get away with it when my son or daughter is going to call you Party. I said, no, I'm going to train your child to call me Kiru somehow. Because it's a nice way to, fool people into thinking you're young by having young friends. So thank you so much. All the very best.
Unfortunately, among all the cancers in terms of frequency, so it's very, very relevant and important. And I thank the management, Dr. Urjitha, for being the reason why we are able to establish such a dedicated breast clinic today. And we have two excellent breast surgeons, Dr. Veda and Dr. Kirti, to run this clinic. Since the media are here, just want to highlight two things. One, there should be more awareness among the public. People should not think I will not get it, number one. They should be aware of risk factors, and let me tell you, the commonest risk factor that I see is overweight. So this is something, this message has to reach the people. And second, they should also be aware that there is a solution. Early breast cancer, 99% survival after 5 years, which is like near perfect. At the same time, advanced breast cancer, it's about 30%. So it's a world of difference between early detection and late detection, and that's what this clinic is all about. Early detection so that we can save every life. And we can at the same time assure all those women who are coming with false alarms.